Hello, my name is Dr. Harpinder Shevchenko from Smiles by the Sea Family Dentistry in Hampton, New Hampshire, and I'm here to answer some of the questions about veneers. So what are veneers? Veneers are thin shell made of different kind of materials which are typically used to, many of the times for cosmetic reasons. Patients might have staining or chipped teeth. So those are thin shells made of different kind of restorative materials, typically porcelain, that help you enhance your cosmetics. When might a dentist recommend doing veneers is a lot of times it's because of patients want to enhance the aesthetics of their mouth. They're concerned cosmetically, they want to improve their smile, whether it could be small minor chips on their teeth, it could be they want to change the shape of their teeth, or it also could be that they want to just enhance the color of their teeth. So those are some of the main reasons that, one might get veneers. So the difference between dental veneers and crowns is, if you think of this way, the crown covers a tooth 360 degrees. So imagine like a helmet. You're wearing a helmet on your head. So it covers the tooth 360 degrees around. Whereas veneer is a thin shell which covers, typically, like I always explain patients, like in an L shape. It's just the front facing and a slightly inward. So that is the biggest difference, the amount of coverage it does on the tooth. So the process of placing the veneers, very first thing is, you will get numb and we will remove imperfections on the tooth and do a small preparation. It's a very conservative preparation that we do for the veneer. I typically use the scanning. I don't use the goopy impressions anymore. We have a very efficient 3D scanner, so we will do the scan. Scan goes to the lab. In the meantime, you will be given temporary shell veneer on the tooth to cover it up, protect you from any sensitivity or any problem that might occur in between. And the lab makes the veneer. A veneer comes back from the lab. We take out the temporary veneers. I might even numb you depending on if the patient has any sensitivity. And then we just put on the permanent veneers, permanently bond them on, and you achieve your beautiful smile. Well, veneers or the bonding cement match your tooth color, yes, especially with the veneers, because typically we are doing the veneers for enhancing the aesthetics, for cosmetic reasons they are being done. So the color match is done. Even when your preparation is done, we match the color. If you're lightening the color or you're just making the color to matching the existing teeth you have. So we use the similar cement as well too, to bond them, making sure that we are achieving the color that we want to as a final result. So the difference between composite and porcelain veneers is that composite veneers are done in the office. So typically, and it's done by a resin composite material, dentists would just pack it, shape it, versus a porcelain veneer is done in most of the times in the lab setting, where we prepare your tooth, that your scan is done, or your dentist might do the impression on the tooth, and is sent out to the lab. And the lab uses the porcelain material. It's almost as a baking, it's baked, it goes through its process. So it's much more solid material. And also it is much more aesthetic as well too. And you can control the shape of the tooth much more better compared to the composite material. So composite, you can say, is like a handwork by a dentist. It's done in the office. Is less stronger as well too, versus porcelain. You have much more control on the quality, the shape, the color, the look of it, and also the longevity as well too. So what should you be doing to care for your dental veneers after you get them? Making sure you're properly brushing your teeth twice a day, you're flossing your teeth. If your dentist has recommended you any special toothpaste, make sure you use that. Sometimes patients also like to use, water pick as well too. So making sure you're keeping your hygiene routine really, really tight. 2 times brushing, flossing. If you have to use any water pick, use that as well too. And of course, coming back every 6 months or every 4 months or 3 months, whichever your maintenance cycle might be for your re-care routine, making sure that your dentist is able to check in anything that is going on, and you're keeping your maintenance program. So the cost of the veneers can vary. It can vary anywhere from $1,500 to $2,200, depending on what material is used, if you have any other work on the teeth that needs to be done to prepare for that. So that's the range that your veneers can cost you. So we do offer financing options for veneers or per se any other treatment that patient might need. We work with different third-party financing companies, which can, you can even have some interest payments and some also without interest payments available as well too. So it depends on your credit score. These days, it's very easy. Most of those companies are a soft pull on your credit score, so it doesn't get affected, and you're able to get your treatment done. So insurance usually does not cover the cost of veneers because they are mostly considered cosmetic. They are mostly done for, aesthetic enhancement. So typically insurances do not cover veneers. I hope I was able to answer some of your questions about veneers. If you have any other questions, don't hesitate to call us at 603-926-8827, and we will be happy to help you achieve your smile.